It's the third most commonly diagnosed cancer in the US, the second leading cause of cancer death for both men and women. But first and foremost, colon cancer can be prevented.
Colon cancer is one of the few cancers that you can do appropriate screening and actually prevent it from developing.
Dr. Matthew Kalady does colorectal surgery at the Cleveland Clinic. He says people should get colonoscopies starting at age 50 or age 45 for African Americans. The guidelines for people with a family history of colon cancer are different.
We know that colon cancers can run in families. Even just to have one first-degree relative, meaning a brother or sister, parent, children, if you have one first-degree relative, that increase of cancer for you goes up quite a bit. We know if you have multiple people in your family that have cancer, that increases the risk even higher. And there are definitely syndromes that run in families where you can have a genetic predisposition where it gets passed down generation to generation, where you're at almost 100% risk of getting colon cancer.
If you have a family history of colon cancer, you should be screened earlier.
It's usually 10 years younger than the first cancer in that family. So for instance, if someone had cancer at age 50, then they should get their first colonoscopy at age 40.
The FDA recently approved the pill cam, but this doesn't yet replace traditional colonoscopy.
But I have to caution and say that it is only for a certain population. It's for the people that have not been able to get colonoscopies for various reasons, or they've been able to have an incomplete colonoscopy.
Dr. Kalady explains how it works.
You swallow it. It's about the size of a pill, almost about an inch long. It's a fairly big pill. And there's a camera in it, and there's a wireless transmitting device that the patient wears on their hip. And as it goes through the digestive tract, it actually sends images as it goes through the colon or through the bowel, and sends images to the receiver on the person's hip. And then someone can go back later and review what all those images look like and see if there's anything abnormal. It doesn't replace colonoscopy at this point, but it's new technology. It is an option in all the different tools to do screening. And I think any kind of tool that is going to encourage people to get screened more frequently is a good tool.
And even with the pill cam, the pre-colonoscopy prep is still necessary.
There's newer preps out that are a little bit more tolerable for people. They're not as quite as severe.
Bottom line, get your colonoscopy.
Everyone has a reason why they shouldn't get a colonoscopy. It's not a fun test that anybody wants to do, and everyone's got stories about things or know somebody that had a bad experience. But the reality is it's a fairly simple procedure. The hardest part might be doing the prep beforehand, which is usually the night before. This is a preventable disease. The way the cancer develops is you have a normal lining to the colon, to a kind of a precursor lesion, which is called a polyp or an adenoma, and then that then becomes a cancer. So through screening for colonoscopy, you could pick up these polyps and get them removed before they become cancers. So it's invaluable.
For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.